Hello, my name is David Rosmarin. I am chair of dermatology at Indiana University in Indianapolis, Indiana. Today, I'm going to discuss a poster from Winter Clinical titled Durable Repigmentation with Ruxolitinib Cream in Patients with Progressive Vitiligo. It's a pooled subgroup analysis from the 104-week TRuE-V phase 3 studies. So one question that we have from treatment of vitiligo is there a difference when we treat patients who have progressive or active disease compared to patients who have just stable vitiligo? And about a quarter to up to a half of patients may have progressive vitiligo. So basically, this question was asked of participants in the phase 3 program, and there were about 440 patients in total. About a quarter of them had progressive disease, the rest had stable disease. And then looking at the facial repigmentation by the facial VASI score and the total body repigmentation by the total VASI score, we see that patients, whether they have progressive or stable disease, repigment similarly. And that's true at multiple time points, at 24 weeks, 52 weeks, or 104 weeks. And also by looking at different measures, such as the F-VASI 50, F-VASI 75, T-VASI 50, T-VASI 75, they behave similarly. Additionally, we're not seeing any difference in side effects. Really, the baseline characteristics, besides the fact that the progressive and stable disease are also similar. So this gives us a lot of good information that we can counsel patients that whether they have active disease or stable disease, they can rest assured that ruxolitinib cream will work similarly well in both scenarios. There are four main signs that a patient's vitiligo may be active. The two most common signs are confetti lesions, which are 1 to 2 millimeter depigmented macules, and also trichrome vitiligo, or three-colored vitiligo, where you see the normal skin color, the deep white patches, and then a color in between. Less commonly, but also associated with active disease, is when patients have the Kebner phenomenon. So a scratch or some trauma may induce the lesions. And finally, and very rarely, is inflammatory vitiligo, which is a pink border around the vitiligo. And that's also sometimes associated with pruritus. One of the other findings, which we've seen in this study as well as others, is that the vitiligo continues to improve over time. And about half of patients are achieving 75% or more repigmentation of the face and 50% or more repigmentation of the body. We also see, though, this trend for improvement with both progressive and stable vitiligo on different anatomic regions as well. So whether we look at the head and neck region, the upper extremities, lower extremities, or trunk, hands and feet, we still are seeing similar levels of repigmentation, whether patients have progressive or stable disease.